I'm in this ERP training and I started thinking, I wonder if they can do this in virtual reality. If I put my clients in a virtual reality setting where we can literally change their body and make them face that fear earlier on in the process, will it decrease the amount of time overall that they're in treatment for eating disorders? Because that's one of the biggest fears I see, and it's scary and it's hard to face, and you have to face it. We've been testing it out with clients and the response has been great. I have spent the last 6 months researching it, meeting with several different software platforms. We had a psychologist who's been doing it for 13 years. Like, she was telling me, like, the equipment they were using 13 years ago is nothing like what they are doing now. Not many people have been doing it that long. It was sparked by, how do I help my eating disorder clients face some of their biggest fears in a way that I can't do just by talking with them? The research shows, like, some of the clients with specific phobias, 2 to 3 to 4 VR sessions, and they've dealt with the phobia. And that's one thing, like, when you first start, you think it's very specific to certain situations. And Dr. McMahon, the psychologist that did some training with us, really helped us see and understand that there's so many ways you can apply it. It's very applicable for OCD. There's scenes where we can put you in a dirty room and have you face, like, germaphobes. There's scenes where we can put you on cliffs or a high building to face fear of heights. Airplane, hospital. I did one with a client who was getting ready for surgery, and we put them in a hospital setting in a recovery room. And so much is our inner self-critic, our negative self-talk. I can put you in a situation where maybe you're in a room, like, there's a lot of the scenarios where you're in a room with other people, you're having to present, or one is just an outside crowd, right? And I can put you in that scenario, and whatever it is that we've been talking about in terms of your inner critic, your negative self-talk, I can put you in that scenario that tends to bring up automatic thought. My body image clients, we can put them in a body image when you're facing a mirror, and I'm having them actually verbalize the things they say to themselves. You have an inner self-talk, I can't do it, I'm not good enough. I can put you in any one of those scenarios where in your life you might be thinking in your head, I'm not good enough, I can't do it. And once I make you start verbalizing it, it becomes more real. You're more aware. We can unearth some of the fears you probably haven't faced, and then we can start processing that. And the evidence shows that with VR, the avatar and the VR environment makes it feel real enough that it does elicit those, like, physiological anxiety, distressing responses, but it's not so real that it's, like, too distressing for a lot of people. Using a SUD scale helps us kind of gauge how high on the anxiety scale they are, because our goal is to purposely increase that anxiety and then help them bring it back down, building their resilience and their confidence that they can bring it back down. So use that skill to help gauge how effective the VR environment is, the prompting from the therapist, and the skills that we're working on teaching them. But clients have been surprised how realistic it is. We want our clients to feel confident and face their fears, whether it be an actual fear, whether it be a perceived fear in their mind, and this is a way we can replicate it in a way that there's no other way to.